Hello everyone and welcome. I just wanted to maybe clarify a few things. I think the book does a really good job of talking about RABT, but I wanted to be able to clarify and add some stuff that might not have been touched on in the book. Before I do that, let me make you aware that if you had tapes due today, that you can bring those next week. And also, please be aware, please make sure that these tapes are audible and that you've also integrated the person-centered aspect in whatever theory or technique you were trying to do. This will be very important, and this is those are the two most common reasons why I have to either grade down a tape or have you do it again. So please pay attention to that. Albert Ellis, I saw him speak in a conference a couple years back, and several years back, because he recently passed away. But he struck me as being one of the people in the world that one of the few people in the world I've ever met who truly didn't seem to care what other people thought about him. And I started thinking that that would probably be fairly liberating, to not care, to care deeply about others and to do for others without any expectation of receiving in return. I don't know how often we actually do that, but he struck me as somebody who really lived this therapy of not caring what other people thought about him. And I did wonder, well, what impact would that have on things such as anxiety and depression, on anger and so forth. And one of the chief overriding themes, I think, of rational emotive behavior therapy is the whole concept of self-acceptance and increasing self-acceptance, which he labels as USA, unconditional self-acceptance. And then also the aspect of UOA, unconditional other acceptance, recognizing that we're all fallible and we have our faults, but we still are unique and talented individuals and can do what we choose to do out there, as long as we're mindful of our thoughts and pay attention to irrational beliefs and not let them take us over. Another real key concept here is that we're not here to make folks happy. Hopefully they can get there someday, or notice the times in their life and their days when they are experiencing some happiness. But this is about moving somebody who may be feeling a 4 on a scale of 1 to 10, 10 great, 1 terrible, and helping them move to a 5 or a 6. He talks about unhealthy negative emotions being depression, anxiety, self-loathing, rage, and that the ABCD model of rational behavior therapy can help folks move to healthier emotions such as sadness instead of depression, maybe irritable, maybe a little nervous instead of extreme anxiety, maybe irritated with self instead of self-loathing, and you get the point here. So we're not trying to move from feeling bad to happy, but it is improving the emotions a bit and taking a close look at some of these beliefs that we hold on to that may not be serving us very well. I wanted to talk in particular about the disputing section of the ABCD model. Now, I've used ABCD model in group, and I found it really helpful and kind of fun to use, because what we would do in group is everybody individually would work with a particular issue that they were dealing with, and then we would have group members add to the disputing part for an individual person. I saw this work pretty well in some cases, particularly when people were really stuck with, well, I don't know how to dispute this, and they were kind of running down a pretty narrow path of not many options related to how I can get around this bad feeling and my perception of what went on. And when other group members can add, it seems very helpful. In individual therapy, a key to this will be the practice part, what's done outside a session. And I think it's going to be really important for you to understand, because if you were to do just the ABCD model and walk through that in one session, I don't think you're going to see a tremendous effect. I didn't. But if you can get somebody to practice it outside a session, and for instance, you have somebody imagine something that causes them great distress. So even imagining it, closing their eyes and imagining it and getting in touch with that depression or the anger or whatever it might be. And then once they get to that spot, ask them to see if they can use whatever strategy, some calming self-talk, some images that may work for them, images of themselves as a child, and that you wouldn't treat a child with such negative self-talk and so forth. and ask them to see if they can't lift that emotion a bit, if they can't move from the depression to just a state of sadness. But then it's got to be practiced, and that was one thing that he talked about is, we read in the book about his shyness and how he overcame that by going and sitting down and talking with a lot of women in Central Park, I believe it was, or a lot of people. But that practice is key to this, so it's not a one-time deal. And I could see as a student, oh, I tried ABCD, it didn't work. It's not going to work without the practice. So either the cognitive disputing, the imaginal disputing, which could be that you actually imagine a worst-case scenario over and over and over again until it loses some of its energy. And then the behavioral disputing would actually be arguing vigorously with your negative self-talk. I remember Mary Goulding in a workshop once. She was working with a woman, and she was pretty stern with her. She goes, "Would you treat your own child or dog with the self-talk that you're using with yourself right now?" It seemed to work well in this particular situation, but it was a nice point that, hey, you're really treating yourself badly. Is that working for you? And would you do that with other people? There's a saying, I think it came from John Kabat-Zinn, about, to treat ourselves with as much kindness and respect as we would somebody who's in pain, a sick relative, or a pet that's hurt. That's one thing I always kind of keep in mind when I find myself beating myself up. And it's also nice to have that photograph, like we brought in with Person Centered, a photograph of ourselves when we felt good about ourselves. And maybe it was when we were young and feel, happy and more innocent. The shame attack is pretty cool. I've seen this done, but there's some YouTube videos, and I think there's a girl walking around a mall kind of with a leash with a banana on it. The whole idea behind shame attack is do things that cause you to stop caring what other people think about you. Some of the exercise of her is going into an elevator and looking at everybody instead of facing the door and looking up like most of us do. Going into a restaurant and ordering a glass of water and then not getting anything else and getting up and leaving. But I'll leave it up to your imagination. Maybe there's some other shame attack. Things that don't hurt others, clearly, but that we could use to create, I don't know, some attention or whatever, and slowly get used to not caring about what other people think about us. It sounds like it could be pretty liberating. It seemed like it worked for Albert Ellis. I'll end by just saying that he did talk about that we can't change our past, but we can change how we think about, feel, and behave about our past. But it will take the mindfulness of paying attention to our some of the more extreme thoughts that we've inculcated, and being willing to consider different options there. So wish you the best. Try out some of the assignments, and I will look forward to seeing you next week.